Today I want to teach you about endometriosis. What is endometriosis? It is a non-malignant condition where endometrial glands are located outside the uterus. Generally, the endometrial glands are located inside the uterus in the endometrium, in the inner layer of endometrium. But in endometriosis, it is located outside the uterus. And it is seen in 7 to 10% women in the US. Only in female, not in men. The location are ovaries. It is the most common location. It is 60% and even bilateral. And next one is uterosacral ligament. It connects the uterus and sacrum. This ligament connects the uterus and sacrum. Next one is recto-uterine pouch. It is a pouch of Douglas. And the fourth one is peritoneum. What is the pathobiology? Ectopic endometrial tissue leading to estrogen-stimulated inflammatory response. What are the associated conditions? It is chronic pelvic pain and endometrioma, or it is called as ovarian endometrioma. It is also known as chocolate cyst. Why it is known as chocolate cyst? Due to color. Yeah, also due to color, and the other things are, the most accepted theory is retrograde menstrual theory for endometriosis. In menstruation, the blood flows from upside to downward. Okay. But in retrograde means this opposite. So blood flow from downward to upward. So from uterus into like ovaries, fallopian tube, abdomen. The portion of uterus, that is endometrium, along with the blood, it goes from endometrium of uterus to ovaries. The most common in ovaries. So it looks like cyst. It is brown tarry fluid. It is converted collected fluid which pass from uterus into ovaries. So it is known as chocolate cyst. Cyst filled with menstrual blood. Endometrial like tissue travel outside of uterus. That is especially in ovary. You need to remember this chocolate cyst for this endometriosis. And what are the symptoms? Symptoms are dysmenorrhea, that is painful period, dyspareunia, that is painful intercourse, dysphagia, painful defecation, and infertility. Why infertility? Because the endometrial tissue travel from uterus into the ovaries. So there will be defect in ovary. It is related to infertility and chronic pelvic pain. And in the physical exam, we can see nodular thickening of uterosacral ligament, because the common location after ovaries is uterosacral ligament. There is nodular thickening. Because why nodular thickening? Because the endometrial tissue travel from uterus then to uterosacral ligament. So we can see nodule-like formation. There is a fixed retroverted uterus, tender fixed adnexal marks. In ultrasound, we can see clearly. What's diagnosis? What's the diagnosis? Diagnosis is laparoscopy. It is the gold standard diagnosis for endometriosis. And studies. The lab studies is CA 125, level is increased. And treatment depends on age, chocolate cyst, size, severity of the chocolate cyst. And the first line treatment is conservative, that is observation. And the medical treatment include combined hormonal or progestin only contraceptive. That is the first line treatment. What are the drugs which include hormonal or progestin only drugs? They are anastrozole, letrozole. What are the drugs? Anastrozole and letrozole. What does this drug do? This drug reduce the pain and decrease the endometrial growth. And the second line treatment is GnRH agonist. What is GnRH agonist? It is gonadotropin releasing hormone. So it suppresses the FSH. What are the drugs? Leuprolide, goserelin. Okay, what are the GnRH agonist drugs? What are the GnRH agonist drugs? They are leuprolide and goserelin. It suppresses the FSH. And the third one is IUD, levonorgestrel releasing intrauterine device. It is also another second line treatment. And danazol. Danazol is not commonly used due to side effects, suppress FSH and LH both. And for the surgery, we can do laparoscopic dilation. The second one is total abdominal hysterectomy with lysis of adhesion. The second one means hysterectomy is removal of whole uterus along with lysis of adhesion. Those adhesion are which are remaining outside of uterus, we can also do lysis.
धड़कनों में तेरे गीत है मिले हुए,
क्या कहूँ तो शर्म से है।